is managing the symptoms. It's supportive care.
Because it's self-limiting, right? It gets better on its own eventually.
Precisely. The goal isn't really to cure it in the traditional sense, but to make the person comfortable while the inflammation runs its course and the thyroid heals.
So dealing with that major symptom, the pain and inflammation, what's used?
For mild to moderate pain, standard NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen or sometimes aspirin can be enough.
Okay. But what if the pain is really severe?
Then corticosteroids are usually needed. Prednisone is the common one.
Steroids, okay. How do they help?
They are potent anti-inflammatories. They work quickly to dampen down that immune-mediated inflammation in the thyroid, which significantly reduces both the pain and the swelling. The typical starting dose mentioned is around 20–40 milligrams per day.
And that usually brings pretty rapid relief for the pain.
Often, yes. Then it's usually tapered down slowly over several weeks as the condition improves.
Okay. What about managing those temporary hyperthyroid symptoms, like the racing heart or tremors?
For those symptoms, beta blockers are the go-to, drugs like propranolol.
And they work, but
They don't affect the thyroid hormone levels themselves, but they block the effects of the excess adrenaline that's stimulated by the high thyroid hormone. So they slow the heart rate, reduce tremors, help with anxiety. They manage the symptoms of the hyperthyroidism.
got it. And the sources had a really strong warning about not using certain drugs.
Yes, absolutely critical point. Antithyroid drugs like methimazole or PTU should not be used.
Why not? They're used for other types of hyperthyroidism, aren't they?
They are, but those drugs work by blocking the production of new thyroid hormone in the gland. In SAT, the hyperthyroidism isn't caused by overproduction. It's caused by the leakage of preformed stored hormone from the damaged follicles.
Ah, so the antithyroid drugs wouldn't stop the leakage.
Exactly. They have no role, they won't help, and they just add potential side effects. It's a really important distinction. SAT is a destructive process, not an overproduction process initially.
That makes total sense. You're managing the fallout from the damage, not trying to shut down a factory that's working overtime.
That's a perfect analogy.
What about later, if someone enters that hypothyroid phase? Is treatment needed then?
It depends. If the hypothyroidism is mild and not causing significant symptoms, sometimes doctors just monitor it. But if it is symptomatic,
Like causing fatigue or other issues?
yes. Then levothyroxine, which is just synthetic T4 hormone, is usually prescribed to replace the missing hormone and alleviate those symptoms.
But that's also usually temporary.
Often, yes. As the thyroid recovers, the levothyroxine dose can typically be reduced and eventually stopped in most people.